You're listening to Razorcast, USA's hottest podcast, bringing you cutting-edge interviews from leading industry professionals.
Hello, everyone. This is Liz Harvey coming to you from our Razorcast studios in New York City, where we are dedicated to bringing you cutting-edge interviews from many of the leading industry professionals across the U.S. In today's episode, we are speaking with Dr. Matthew Phinney. Dr. Phinney is the founder of the Chiropractic Doctors in Grand Rapids, Michigan, where he is committed to improving the health and vitality of his community through chiropractic and wellness care. He is originally from Toronto, Canada, and he graduated from Palmer College of Chiropractic in Davenport, Iowa. Dr. Matthew Phinney is widely considered to be one of the top chiropractors specializing in holistic and alternative health in the country, and he is also a contributing member of our national network of industry professionals. Today we're going to talk about a very important topic, ways to an easier pregnancy. Hi, Dr. Phinney. How are you today?
Yeah, I'm doing great. Thanks for asking.
Thanks for joining us. And are chiropractic adjustments safe during pregnancy?
Without a doubt. You know, millions and millions of women across North America, they seek out chiropractic care often for the first time during a pregnancy. And the reason why, for all the women out there, you guys know, you get a lot bigger. You gain, probably average pregnancy weight gain is 25 to 35 pounds for the average size women. So you gain that weight, and you do that in a very short period of time. And so oftentimes that can cause a lot of stress, undue stress and strain on the joints and the discs of the body. And so most women that are pregnant are uncomfortable. You guys know that. You're looking for some sort of relief, but you don't want to take medications. You don't want to take pills due to the side effects that can happen with your body, but also the developing body that's inside of you. So yeah, we see a ton of women, pregnant women, oftentimes for the first time during the pregnancy, so looking for relief, but they want safe relief. They don't want anything that can cause dangerous side effects.
All right, so how can an expectant mom have an easy pregnancy?
Yeah, and so most women, when they do come in first time, that's really one of the things that they tell us they're looking for. They want an easy, they want an uncomplicated pregnancy, labor, and delivery. And so keeping the spine, keeping the hips, keeping the pelvis in optimal alignment at all times during a pregnancy is a requirement for that to happen. And so pregnant women, obviously, we go through an exam. We go through a consultation. We figure out exactly what it is that they're looking for. We go through the exam. So we go through the orthopedics. And really what that does is it puts their body in different positions, functionally, structurally. So it tells us how things need to move and what needs to go where. There's also we utilize what's called a Webster Technique. So it's looking at the sacrum and alignment of the tailbone. And we're doing different checks with different ligaments in the body to see how we need to adjust and what needs to go where. The other thing that can happen during a pregnancy, if something is twisted or shifted in the hips or the lower back, it can produce a condition that's called interuterine constraint. And so picture like the uterus is like a bag. If you have 4 strings attached to that bag and you pull tighter one side than you do on the other, well, then that bag tightens up, and that can interfere with how the baby's able to move and grow and develop when he's inside mom. And so his head could get stuck one way or stuck another way. That can produce a condition we call torticollis. Torticollis, pressure on the nervous system, can cause things such as ear infections, headaches in children, multiple rounds of antibiotics. So really keeping everything in alignment, keeping everything adjusted during your pregnancy is a fantastic way not only for you to stay comfortable, but also for the health and development of your young child.
All right. And so does chiropractic care help with getting pregnant?
So that's a great question. So same thing. We've seen, and that's not really typically the most common thing people come in with, but we've had multiple occasions where women have tried years and years and years to conceive. They've done in vitro. They've done all of the sort of different pregnancy protocols. They've done all the nutritional supplements. They tried everything, and it wasn't until they actually came and they got their nervous system working, they got their hips, they got their back, they opened up the nerve channels that are going to the reproductive organs, that they were actually able to get pregnant. And it's pretty amazing, and you think about the effect that has on a family, and psychologically being able to have children and being able to start a family. There's people out there in your community right now that are going through this stuff, and they don't know that chiropractic is something that can help with that. Same thing, I've seen women that have been without, say, a menstrual period, amenorrhea, for years, even young women, and then all of a sudden they start getting adjusted, and boom, it comes back. And they're able to start a family, and they're like, wow, awesome.
That is awesome. So once you're pregnant, are there any secrets to an easier labor and delivery?
Yeah, obviously, keeping yourself in good shape. So exercising, light exercise is a requirement. It's something that we obviously recommend. Staying flexible, so doing just light things, light yoga, different sort of positions are great. Because really, it can be a marathon for the women out there. It's very, very tough. It's very tiring, and you guys are going through, probably for first-time pregnancies, one of the toughest things that you may ever do. So keeping yourself in good shape, proper nutrition, and there's different nutritional supplements and protocols that we recommend for women that are pregnant, for women that are, say, pregnant and have had trouble with previous pregnancies. There's other nutritional protocols that we'll recommend for them as well. And then obviously keeping the hips, keeping the pelvis, keeping everything in optimal alignment, keeping everything moving. So you can have an easy, uncomplicated pregnancy, labor, delivery.
And what treatments do you recommend for a healthy pregnancy?
Well, obviously, I recommend getting everything checked, making sure that everything is moving, everything is in alignment, making sure everything is working, functioning the way that it's intended to, so that we don't have any issues. So again, we use the Webster Technique, Webster protocol, to make sure the hips, make sure the pelvis is optimal alignment, and then we typically check maybe once a week to twice a week, just depending on where they are, how far along the pregnancy is, just to make sure everything's ready to go, everything's ready to rock and roll. And then also there's a couple other nutritional supplements. They're specific, though, based on that individual. So there's a pregnancy protocol that we would recommend, but rather than me sit here and sort of give people broad stroke solutions for very specific problems, and that's really one of the big problems with the healthcare industry today, is we're given these sort of across the board, you got to do this, and you got to do that, and you got to do that, for individuals that have very specific and unique situations. So the best thing to do would be consult with someone that's familiar with pregnancy and is familiar with adjusting women that are going through pregnancy, and have them get checked.
All right. Well, thank you so much, Dr. Phinney. We know you're extremely busy, so I just want to thank you for your time and your help today.
Yeah. Thank you very much.
You're welcome. And for our listeners across the country, if you are interested in speaking with Dr. Matthew Phinney, you can either go online to www.thechirodocs.com or call 616-432-3103 to schedule an appointment. And on behalf of our entire team at Razorcast, we want to thank you for listening, and we look forward to bringing you more top-quality content from our country's leading industry professionals.
You've been listening to Razorcast, USA's hottest podcast, bringing you cutting-edge interviews from leading industry professionals.